Measles cases are slowly spreading across the country, and there are now more than 300 cases here in the U.S., including at least one case that we know of in Colorado. A lot of people are wondering how we can protect ourselves. Our 90s medical expert, Dr. Paul Coley, joins us now to talk about it. So we're talking measles today. Do Americans need a booster? I mean, you get the shot when you're young, my kids are getting it, but what about adults?
Yeah, I mean, this is a question patients have been asking me almost every single day, especially because this measles case is at my hospital. So the good news is for most healthy Americans, the answer is no, you do not need a booster because if you've had 2 doses of the MMR, you're 97% protected. Now, if you've had 1 dose, you still have about a 93% protection. But there are some groups of Americans who we are recommending boosters for. So listen up. So if you were born after 1957, but got vaccinated before 1968, so that 1957 to 1968 window, they were using a different vaccine. They were using an inactivated virus that wasn't as effective. So they're actually recommending a booster for that group. If you're, someone who works with people who can't get the vaccine, like pregnant women, cancer patients who are immunocompromised, your risk of getting it through them is much higher. So they're actually recommending a booster for that group as well. And if you're someone who's high risk for exposure for other reasons, you're traveling to an area where it's endemic, another part of the world or what have you, you may want to think about a booster too.
Well, let me ask you, because MMR, obviously a requirement for kiddos to go to school. You get these when you're young. What if you're an adult or young adult? You just don't know if you've had it or not. Like, how do you know that you are protected if you got it a gazillion years ago?
Yeah, so it depends on your age. So if you're born after that 1967, you're probably and born here in the United States, you're probably protected because you probably got the MMR. If you're an immigrant and born in another country, you may want to think about getting your titers checked. So the best way to know whether or not you're protected, and I actually made my mom do this because she was born in India, and we don't know whether she got that new vaccine or the old vaccine or what she got. And so you can get a blood test, which looks for antibodies against the measles virus. And if you have a high enough level, you have a level, that means you're protected. Now, sometimes the level will come out what's called subtherapeutic, meaning too low. In that case, again, it may signal your doctor to actually go ahead and give you a booster to protect you more.
Is it just the worst thing in the world to get that natural immunity and just catch it and we'll survive? That's not the way to go?
It is the worst thing.
Okay.
There's a 20% chance you'll end up in the hospital. There's a chance you could get blindness, brain swelling, permanent ear loss, pneumonia. If you're a kid, you could even obviously have a high risk of dying. And then it's not just the acute infection, you could have long-term complications. So this idea that's been trending on social media of just let it happen, absolutely the worst idea when it comes to a highly preventable infection like measles, which is also highly dangerous if you do end up contracting it. Now, most people born in the US before 1957, before we had the vaccine, actually have natural immunity. So if you talk to your grandparents and such, you might hear that they've had the measles and recovered. But again, a lot of them can have long-term complications from that.
Yeah, why put your body through that if you don't have to? It's insane. Also, insanity going around social media. There's these influencers and a lot of folks saying, oh, just take these certain vitamins and you can, do it without having to get a vaccine. And what's your opinion on that?
So vitamin A is what's been trending. And because there's some data from the World Health Organization that giving vitamin A to kids who get severe cases of measles, and mind you, this is data from countries where kids are vitamin A malnourished, not here in the United States, can help with their recovery. So that's more if you get the infection, you're a kid, you have severe infection, you talk to the doctor about vitamin A. It is not a preventive therapy. There's no evidence whatsoever that vitamin A prevents measles, but the vaccine does very effectively prevent measles.
Okay, and final question, because I'm sure folks have this too. If you're thinking about getting a booster, but maybe you don't need it, is there harm there? Are you putting too many antibodies in your body? You know what I mean? Is there anything wrong with that?
So if you don't need a booster, because your titers are normal, do not get a booster because this is a live virus. They're actually putting a weakened version of the live virus in you, so it can cause complications. And, I had attending a supervising doctor who actually got ear inflammation and developed hearing loss because he got a booster when it wasn't necessary. So definitely don't go out and get it if it's not necessary. If you do need one, it's the best way to protect yourself and to really protect the pregnant women and the immunocompromised patients and the ones who can't get that booster.